And speaking of our next guest, we want to talk about whether consumers really will start cutting back on those nip tucks to save cash during this economic downturn. Vicki Ward is a writer with Vanity Fair as well as a CNBC contributor, and we are joined by Dr. Richard D'Amico. He's the president of the American Society of Plastic Surgeons. Great to have you both.
Thank you.
Doctor, I do want to start off with you. Certainly the stocks tell a story, and that is that perhaps consumers are cutting back because those stocks are down. What are you seeing in your practice?
Well, what we're seeing in the country as well as in my practice is very little change for the moment. Realize that most cosmetic surgery is booked months ahead. So if we see anything, we usually lag the economy. We are economic sensitive. We recognize that. But I don't think this is going to be a major impact. I think, if anything, some people who've saved up for surgery for several years, the saving plan may have slowed down a little bit with the mortgage issues and other concerns. And if we don't see them in April, why, they'll be back in October. So I don't see a major change. This is just a market-sensitive dip.
So we don't see that right now, but in other words, because the savings plans are in place and they might be cut back, the bookings for future procedures, we might see that down the road.
I think we will. I think we will. We've seen it with other market downturns, 87, 2000. So, of course, this is discretionary spending. But what we found is those patients will be back. It's just how soon.
Vicki, you've done some reporting on this subject. What have you been hearing from customers? Is it true that for the rich, for the wealthy, that plastic surgery is just a consumer staple, basically?
Well, I think it's actually not just for the rich any longer. I think we live in the age of Botox, and this is the age of Botox, not just for the rich, but for the middle classes. And I think what doctors and dermatologists in New York are telling me is that they actually saw a mammoth rise last year of people having Botox and fillers, and the market, even towards the end of the year when the market was very volatile. And I think that what Dr. D'Amico just said is completely right. I think that women especially do not want to show signs of panic, and nothing shows signs of panic more visibly than a face that once had Botox suddenly denied it. What you do in a recession, if you've got any sense, is not panic, is maybe stretch out procedures. So instead of having Botox every 2 months, which maybe people in California have been doing and really don't need to do, they have it every 4 months instead.
That's a great point, Vicki. And I do want to ask Dr. D'Amico if you've actually seen that happening, where people are actually stretching out the duration of time between procedures, or if they're perhaps choosing one procedure over another, maybe putting off the major surgery but going for the less invasive treatments in order to save some money.
Well, I think that's a good way to look at it. There's really maintenance involved here for some of the procedures, like a Botox or a filler. And then there's the sort of restorative procedures, freshen my face. Now, facelifts were up 15% last year. So things are very strong in that sector. Breast augmentation remains strong. But I think prolonging the maintenance interval with the Botox and the filler is something we might well see.
And Vicki, I do want to ask you, because in your reporting you've also intrepidly gone to hair salons as well and other high-end places where people like to keep up their appearance. And what have you found there?
Well, I think this is where some of what I think is just pure stupidity will stop. There was a report in the New York Times last week that said that something like 25% of high-end hair salons across America were seeing 11-year-olds come in and having $75 haircuts to look like Hannah Montana. Well, I mean, and then there's stories of, pedicures for toddlers, bikini waxes for 11-year-olds. That, I think, if anyone has a brain in their head, has got to stop, and will stop during, I think the thing about an economic slowdown is that it gets people to prioritize. Botox don't know. Botox is not a luxury anymore. We are in the age of Botox. We are in the age of looking young for, well into our 70s. We spend money on expensive food to make us live longer. We do everything to make us live longer. You're not suddenly going to see saggy faces. When you see saggy faces, it'll be the time of the apocalypse is what will have happened.
That's music to Dr. D'Amico's ears, Vicki. Thanks very much to you both for this very good discussion, Vicki and Dr. D'Amico.
Thank you.